Today is March 1st, 2021. I'm here with Elika Razmadru. Was that correct?
It sure was. You got
Oh, hell yeah.
it.
Awesome. How are you doing, Elika?
I'm good. I'm good. I'm happy to be here.
I'm happy that you're here as well. How was so you are a psychiatrist?
Psychologist. So that is like, I
Psychologist.
think the most common mix up there is. So psychiatrists are physicians by training. So they go to medical school and then they complete their residency in psychiatry. So they're a physician first and then receive mental health training through residency and fellowship, and then and prescribe medications. So most of the time when folks are seeing psychiatrists, it's usually some combination of medications, and some psychiatrists do therapy. Whereas psychologists, our graduate training is all in psychology, and we don't prescribe medications. So that is the main difference.
What is psychology?
What is it?
Yes.
Ooh, psychology is the study of the psyche. It's the study of the mind. It's the study of human behavior, human thought, and human well-being. And I think just kind of spans the ways in which human beings can care for themselves and their health.
Is that so? When you went to school for psychology, what did you gain from that?
Like, what did it look like?
Yes.
Oh, I see, I see. So when I went to school for psychology, so that involved, of course, doing whatever I needed for undergrad, which is I did a degree in cognitive science and sociology. And then for our grad program, there's kind of two routes that you can go. So there's the PhD and then there's the PsyD, and both of them are doctorate level degrees, but they just look really different in graduate school. So I mean, this is a really overly simplified explanation of it, but PhDs, the training is much more research oriented. And so for PhD programs, you typically like apply to work with a certain research lab or a certain professor. And of course, you do classes in psychology. You're kind of learning some clinical skills along the way, and you do different clinical and practica. So you kind of do basically like little mini internships every year at a different clinical site. But largely, the focus is on research because a lot of folks then go into academia from there. And then the PsyD is a different degree that was created like I think in the 70s or 80s, like definitely far later than the PhD. But the PsyD is essentially like the focus is really just on clinical practice and clinical work. So it's for people who kind of know that they want to be in a clinical setting. And so from the start, we just take a lot of clinically based classes, and then do a lot more clinical work throughout grad school. So I'd say like for years 2 to 4 of grad school, I was like taking a few classes and then working somewhere between like 16 to 24 hours a week in different clinical sites. And then also was working on my dissertation because you have to do a dissertation either way. So those are the two differences. But yeah, the graduate training for it looks a little bit different depending on like what route you're hoping to take afterwards. So I did the PsyD route, and loved it. And I knew that I didn't want to do research for the rest of my career. I also knew that I just wanted more clinical training than what some PhD programs offered. So yeah, that was what it looked like for me.
So you knew that applying into grad school, you didn't want to be on the research side, you'd rather be on the clinical side.
I did for the most part. When I was in undergrad, I was working with several research labs through. I was at UCI for undergrad, was working at several research labs, so was like involved in research from a pretty early stage. And I love it, and I do enjoy it. But I just had kind of seen what that looks like day to day for the people whose career it is, and for me it just didn't feel like it fit. Like I didn't want to be just kind of like in a research lab doing academic work or teaching. All of those things are interesting to me in like smaller amounts, but I knew that I just wanted to like work in a hospital. I wanted to work clinically. I wanted to like work with people throughout my day. So I think I knew that, and then it was a matter of like figuring out what kind of training that I needed to get for that. And to me at the time, this ID just made a little bit more sense. But ultimately, I mean, what I learned is that you can do really anything regardless of what route you take. You just kind of have to like make up for it in some of the clinical experiences that you get along the way.
Nice. Even if you take a PhD route.
Totally. Yeah. Cause even now, like I think when I started to get to, so part of our training is that like in our last few years, like we have our version of, I guess our version of residency is our pre-doctoral internship. So our last year of grad school. So we're technically still in school. We're like still paying for credits to go to school, but we're basically just working full time at some clinical placement. And the placement that you get is like through this very rigorous, like interviewing match system where like I applied to like 18 sites. I interviewed at like 12 or 13 of them, and then on match day you wake up to an email, kind of like how residency works for med school people. You wake up to an email that says like, oh, you've been matched with this site, and that's where you go to work for a year. So I moved from Oregon to Colorado to do my year of internship, and then after that, so once you graduate you do another year, or 2 years of fellowship. So I just finished that this last year. And so I think in those later years, when you're in like a cohort with a lot of other people from other training programs, like I was all suddenly in cohorts with people who were in PhD programs and other programs, you get the sense of like, oh, you can all kind of end up in the same place if you're just really interested in clinical work. Like ultimately you can do it. But for sure, I could kind of sense the differences in our training that led up to that point. Like even just in working with some of those people, like I can tell that like, like ultimately like you have a research brain and you were trained clinically, but it was different than like the amount of clinical work that I just did in grad school in comparison to some of those folks. But there's so much variability. I think at the time I maybe was just thinking a little bit like rigidly around it. I was just like, oh, PsyD is clinical, so I'm going to do that. Where in reality, like you can make it work, which I think is so much of like so many of higher education degrees and just grad school degrees. You can kind of make it work as long as you're willing to find your place after the fact and find the job experience that you actually need.
So you can kind of guide your own path, using that degree, or would you say no?
I mean, I think that that's the cool part of a degree in psychology is that there's so many different things you can do. So you can work and there's also so many different like levels of it. So like you can do a master's level where if you just want to do therapy for like your career, like there you don't need to get a doctorate to do that. You can do a master's program in marriage and family counseling. You can do a master's program and become a licensed professional counselor. There's so many different avenues. So you can do a master's and then become a therapist. But then with I think the doctorate degree, the fun part is that there are all of a sudden all these opportunities for teaching, and there's a lot more opportunities for like consultation work. Like people are constantly wanting to consult with psychologists on various things. Like I was just talking to a colleague today who found a new opportunity where she's like consulting with a new startup on an app they're trying to create, like a mental health app. So there's all these like little things that pop up. There's obviously like research and academia, and you can go that route. There's like industrial organizational psychology, which is all like you're basically working in usually like very large corporations, and it's more focused on like how to make like a more productive and efficient workforce. I'm sure that I'm not doing that field justice at all. I don't actually know a ton about it, but that's like its own field of psychology. There's like health psychology, which I specialized in, which is like working in medical settings and with people with a range of medical and mental health conditions. There's like pediatric, there's forensic psychology where people are doing like, you know, different like court ordered evaluations and evaluations trying to like assess violence and predictors of violence in offenders. So there's so many different like places you can find within psychology. It's kind of wild how many different specialties there are. So it does feel like on some level like you can really just, I mean, you can, my work life looks radically different from even like my best friends in my grad programs. They're all doing such different things. And I'm like, even with my degree, I'm like, I would need to get so much work experience to be able to be competent at the thing you do. Like, I don't know how to do that very specific kind of assessment for that very specific court ordered evaluation. So there's so many different avenues. And I think that's really what kind of pulled me to it initially, is that I was like, oh, it feels really exciting that there's like this degree that I can get that is specialized in a subject that I love, but that doesn't close doors. Like there's still so many things that you can do within it. So it's like fascinating when you actually go to school, go to graduate school for psychology, because there's so many different personalities, and there's like people that get into it and like love doing assessments and doing like neuro psychological assessments and cognitive assessments. So these are people who could be doing a lot of ADHD evaluations, intelligence assessments, things like that, which is so much more like kind of like rigid and structured in a way. It's like really you're doing these assessments to try to kind of put together all the pieces, but then you're not seeing that person long term, right? You're not actually like doing therapy with that person. You're just doing this initial assessment for them. So there's like different personalities are drawn, I think, to different specialties within psychology, which is just super interesting to see. Like even within, my group of friends, I can kind of recall from grad school, and I'm like, yeah, of course, all of us kind of landed in the places that we did because that was a part of like why we came to grad school in the first place, and we just wanted something really different about it from our own from our experience.
Nice. That's great that you guys all could receive such a broad range of experiences. In
For sure,
my engineering route, there's it's pretty
it's
rigid.
not that.
No, it's
Yeah.
not. So that's and was that an experience that was unique to grad school, or did you have something similar in your cognitive science undergrad degree?
For like things that I was doing to kind of prepare for my role as a psychologist in undergrad, is that the question?
It was more so probably, I would guess it was more so, was there any range to what you were being taught between, or what you and your
Oh,
fellow classmates were learning?
yeah. I mean, I think that that was just kind of a function of being in college and in undergrad, where like you have so much more flexibility as far as what you want to learn, right? Like even within cognitive science, there are like so many random classes that you can kind of choose as electives. Of course, we all took the same core curriculum, but it did seem like there was a pretty wide range. We even like in undergrad, we had actually two different like psychology degrees. We had a psychology and social behavior degree, which was through like the School of Education, and then we had a cognitive science degree, which was through the School of Social Sciences. So even then, it's like different people kind of opt into different degrees, even though they're both a psychology degree. Like I know plenty of people who continue to do clinical work with the psychology and social behavior one. So I think there's just so many options when you're an undergrad, whereas in grad school, like you are on some level applying to a pretty specialized program to begin with. I can't even imagine, like how different it looks in PhD programs where it's like you're really applying to work in a specific research lab for most of your time there. Um, so there's like so many very niche programs. But yeah, I think that was one of the reasons that I loved ours, is just that we had a good range of clinical experiences. And I didn't go into grad school knowing like exactly what kind of psychology that I wanted to do. I wasn't sure if I like wanted to do mostly therapy or assessment or like where I wanted to work. I was just like, oh, this is a really fascinating topic to me. And I really like working with people. And I kind of like the idea of being in healthcare. Like I like that kind of environment and that kind of setting. And so ultimately it was a little bit of like trial and error once I actually was in grad school.
Nice. How long did it take you to realize that you wanted to be in, was it health psychology?
Yeah, yeah. It took me about a year or so, I guess. I was drawn to it because I weirdly enjoy being in hospitals. I don't know why. I just it's like an environment, it's like an organized chaos that just like fits for my personality structure. Like I like the pace of it. And so I kind of like the environment. And then at that point, it was like a year in, it was just around like it partly had to do with what opportunities were available to me. But I think within health psychology, the part of it that I really appreciated is that there is a big push within health psychology to focus on like preventative measures and to focus on helping people make health behavior changes before their behaviors actually lead to some like significant mental health concerns, right? So like to catch people earlier so that they don't even need to go to like a specialty mental health clinic because they have like severe or even moderate depression or anxiety, to be able to like give them some interventions for like how to take care of themselves a little bit better, often in the medical settings where they're trying to seek out that help, right? Because most people get their mental health care at a primary care clinic. For the most part, that's where people go first, and then after, by the time they're actually going to a specific group practice or a private practice clinician out in the community for therapy, it's typically like it's something that they've been experiencing for a while. Usually they just kind of seek that care from their primary care doc. So I think what I liked about health psychology is that it was really focused on like increasing access to mental health resources in the settings where most people are actually seeking care, which is in medical settings. Most people are plugged into their mental health care through their PCP or through other, subspecialty medical clinics. So I just kind of liked that piece of it. I liked that it was focused on like preventative health, and trying to like empower people to use the tools that they have, to try to, for better or for worse, just to take care of themselves as much as they can before needing to actually seek additional support. So I liked that piece of it, and I liked the like interprofessional nature of it. I liked that I was not just going to be like with a room of psychologists all the time. Like in basically every clinic that I was in, I was like one of two mental health people. So it was mostly with like other physicians, physical therapists, occupational therapists. Like I was always working in these really like lovely multidisciplinary teams, which I think just as a human and in your profession, it's fun to be learning from other people constantly. And you're thinking about patient care, so you're like talking about a shared patient, but everyone has a very different perspective and a different idea as far as like what might be helpful and what might also be problematic, and you have all of these different perspectives and opinions in a room, and it just makes for like a very interesting and like intellectually engaging and stimulating work environment. There's just a lot of things to learn even in your like normal day-to-day work.
Absolutely. And having people from multiple disciplines and multiple backgrounds. I mean, if, like you said earlier, there were some of your classmates who had, gotten some training in some sort of evaluation, which unless you got that training, you couldn't do that. I couldn't do
Right.
that evaluation. So all these other sort of medical professionals, coming into this sort of single patient, trial with, they'll bring something to the table that you can't see, and other
Right.
people can't see, and you'll bring
Exactly.
something that they can't see either. So
Yeah, absolutely. I mean, everyone has something to contribute, which is the beautiful part of it. And also like you work on a team. So it's nice to kind of feel that like even with, with cases that are maybe a lot more tough and are really complex, it's nice to have multiple perspectives, and it's nice to be able to like rely on your fellow colleagues and your fellow teammates, and to not feel like you're just kind of doing it on your own. I think it's just like a more holistic approach to healthcare, which is honestly like what we need for most of the, at least for most of the chronic illnesses that people are grappling with now. I feel like we need a more holistic approach to healthcare. And so I think in all of those ways, it's just like, it's also like more sustainable as a provider to have that support and to like have systems where you can lean on other people and consult with other people, and where multiple people are kind of working on shared goals, hopefully. So all of those things also just like make it more enjoyable.
it sounds, the system you're working in sounds more enjoyable than most medical systems that I've seen or been a part of.
Interesting.
How does this system look when you have multiple different professionals in the same environment? Because I don't know if I've actually seen that sort of environment.
Yeah, so this is like a push, I think, over the last several decades of trying to integrate mental health services into various medical clinics, because that's where most people like seek out mental health care. And so the places that I feel like it shows up a lot are primary care. So like, in primary care, we have psychologists, we have psychiatrists, we have social workers in our primary care clinic. And so we work right alongside our primary care docs, our LVNs, our nursing staff, our front desk staff. So we all kind of work together on the same patient panel. So there's, situations like that. And then in other medical subspecialties that I worked in, it's like things like in pain management clinics. Like that's one of the biggest pushes I think in the last several decades, is acknowledging that like chronic pain is a chronic health condition that really benefits from having a multidisciplinary approach. And so in those situations, it's like if you are a patient in that clinic, you're obviously seeing your primary medical provider there. You might also be seeing the physical therapist at the pain clinic. You might also be seeing the occupational therapist at the clinic. You might also be seeing the psychologist, and you're kind of working on different interventions and different goals with each provider, but then your providers are also regularly collaborating together on your care. And that's the like overarching goal of integrated care, is that it's actually a functional and integrated system where like the providers are talking to each other. So the system itself is facilitating communication between all of your providers. And so you ultimately are getting a more holistic approach to care, because you're not just, for example, you're not seeing your primary care doc in one hospital and then going to a PT out in a different community clinic and occupational therapist somewhere else, and then seeing your psychologist who's in private practice, and none of those people are talking to each other. And so if you have a chronic illness or any complex health condition, which so many of them are complex and kind of, impact a lot of different areas of your life, I think that's the main benefit, is that when you have providers who are working on the same team, they're hopefully also talking to each other pretty regularly about the case and can kind of check in with each other if, there are things that the patient says that are confusing or feel like it contradicts something you read in the chart about what they're working on. There's just a lot more well-established lines of communication. And so, I mean, ultimately, you hope that that also translates to just better care, right? Like this person is getting a more comprehensive approach to their care. It's not just like siloed and being received from a bunch of different environments where the people are not having any dialogue or communication with each other. So what it looks like in practice is that we all, I mean, in this clinic that I work in now, I work in an integrated primary care clinic. And so my office where I see patients is in the primary care clinic. So I'm right across the hall from all the exam rooms for where the PCP see their patients. And so part of that is, I think the benefit of actually being integrated is that like, I'm like walking the halls and like seeing the other healthcare providers, can like catch them as we're just walking by each other, just have easy access to them so that we can actually collaborate. And so that's what it looks like day to day, is like getting a lot of referrals from our primary care docs. I will oftentimes reach out to primary care docs when I have like something, a question that's medically related, or like a patient comes to me with a question about their medical care. And I'm like, I don't know the answer to that, but let me go ahead and check in with your PCP really quick and see if we can get that answer. So, it looks like sharing a physical space. It looks like sharing a patient panel. And it looks like a lot of, typically most of those clinics have a lot of like team meetings and case conferences and like places where providers can come together and talk about challenging cases and things like that.
Wow, that sounds very, very, that sounds like a team effort and just like a very rewarding type of work versus a, single office, a single doctor, office, which is what I'm used to. But
Yeah.
clinics
Yeah.
sound way more comprehensive. And for people, like last year, I had something like on my skin, on my shin, and then the dermatologist wasn't not in the same clinic, and I never went because it was just
Yeah.
really far.
Yeah. And I think that's typically what it's like. And I think that's probably what it'll continue to be for medical subspecialties, because that's like a totally different world. Like it's hard for me to imagine like a dermatologist working in the same place as like, I don't know, a rheumatologist, and then same place as like a primary care doc, because they just do such different things. So I feel like it'll continue to kind of look like that in medicine, I'm assuming. But I think the main difference for us is that like, things like mental health are being more integrated into all of those clinics. So like even in all the medical clinics, last year I worked in pain management. I also worked with the palliative care service that was doing mostly like inpatient and outpatient work. In the past, I've worked in oncology. I've worked in the bone marrow transplant unit. I've worked in substance use. So like there's all of these other subspecialties within medicine where mental health is being more readily integrated, because for a lot of those folks who are being served, even in places like a GI clinic, right? A clinic that is specifically focused on GI symptoms or GI diseases, I guess you'd call it. There's still a role for psychology for mostly because we know that stress can really impact a lot of those conditions. And so we're just seeing more and more integration in that way. And I do think, yeah, like to your point, I do think as a patient, it feels good to be able to receive your care in the same place, right? And to like know that your providers are talking to each other.
Yes, absolutely. That, because I mean, you could go to a whole nother place and they have none of your medical history, don't know what medications
Yeah,
you've been on for 2 years. It
yeah,
can be bad.
for sure.
For one aspect of therapy which I am pretty curious about is pain management therapy.
Mm.
Have you gone, or have you adhered that, or do you have any how have your experiences been in learning, you know, pain management, mental health, providing
Mm.
for it?
So for chronic pain.
Yes.
So yeah, the main there are a few different types of therapies out there, but I mean, over the last several decades, I think the research has shown that people just benefit from a multidisciplinary approach to pain. So that usually includes some combination of course, the medical interventions and medical procedures that you're getting from your physician at the pain clinic. It also includes like physical activity and safe movement, and so usually working with PT is a big part of that. And then it also includes managing your mood in general, because we know that it's actually really wild. Most of the places that you see in the brain light up when you experience pain are essentially all the same places that you'd see light up when you experience emotional pain. So when you experience emotions like anger or upset or sadness, like those are mostly the same areas of the brain that are involved. And so what we see is that for most of our patients with chronic pain, for like a large majority, I mean, not, I shouldn't say large majority, that's maybe hyperbolic, but a large number of them experience mental health concerns, because pain is as I'm sure a very distressing thing that we all experience. And when it's chronic, and when that alarm system is constantly going off in your body and in your brain, that starts to kind of take away from that capacity that we have to deal with our day-to-day stressors and to manage our mood. And so what we see are increased rates of things like depression, anxiety. What we also see is like just having a shorter fuse. So a lot of people with chronic pain will find over time that they're just like, wow, I find myself kind of reactive to things that maybe previously I knew that I could deal with, right? Like I wouldn't even think twice about it, but all of a sudden someone says something in a particular way and I feel my body kind of getting activated. I think that's one of the things that I hear so often. So we see that our ability to just manage and regulate our mood becomes diminished over time, because part of what's happening when we experience chronic pain is that the body is constantly in a state of activation. Your nervous system, that part of your body that's responsible for reacting to stress and responding to stress, is constantly being activated when that pain signal is going off. And so naturally over time, that makes it really hard for us to be able to manage our mood when our body's already kind of a little bit on hyperdrive because of our nervous system. So the biggest pieces of therapeutic work for chronic pain is really around working on a lot of self-regulation exercises. So a lot of the work that we do is just like teaching different relaxation practices, different self-regulation skills, doing a lot of breath retraining, doing practices that can calm the nervous system down and that can kind of send signals to the brain that your body is safe, you are safe, and that you can be calm, which, all of that's happening without really a lot of conscious awareness. But those relaxation practices are kind of at the basis of how to take care of yourself if you are someone who lives with chronic pain. And then there's a big push, especially in the most evidence-based treatment for chronic pain is something called cognitive behavioral therapy for chronic pain. That, and there's one other form of kind of like a cognitive behavioral therapy called acceptance and commitment therapy, and they're both pretty well studied for folks with chronic pain. But a lot of what they both involve is taking a really good look at cognitions around your pain, and specifically catastrophizing, which is like, these catastrophic kind of anxious thoughts that we have about worst case scenarios. What we find is that happens very frequently for folks with chronic pain, is that they have these catastrophic thoughts about like, will this ever go away? Will this pain ever stop? Will I ever be able to do anything again? Right? Like we have these thoughts, which are all very normal reactions to experiencing this really intense sensation in the body. But we have these catastrophic thoughts. And what we see is that having those thoughts actually just makes us feel worse over time, which I think is not that surprising, right? Like we have this natural tendency to think through the worst case scenario. And what it actually does is that it decreases our mood over the long term. So we work a lot on looking at thoughts and how we're kind of talking to ourselves, how we're talking to ourselves throughout our day. And then a big piece of it is also kind of looking at your activity and your behavior. So looking at what are the things that you've maybe just kind of stopped doing because of the pain? What are the things that you now avoid doing because of the pain? What are all the things that you've done to kind of like isolate or withdraw from your social support? So we really look at behavior, we look at thoughts, and then we look at just activity in general and kind of like what you're doing and what you're doing less of. And so in therapy, it was really interesting. You know, our work would involve, despite me being a psychologist, like part of the main intervention would be that they would start a walking program. So for people, you know, I often worked with people who like had a lot of very valid fear around movement, because movement for them had been associated with increased pain, right? If you are someone who experiences chronic pain and you move your body in certain ways and then you experience more pain as a result, the brain eventually learns, oh, okay, don't do that thing because that's going to cause more pain, right? So you learn that over time. Your brain is constantly forming these associations. And so one of the first interventions we do is a walking program. So like that's a situation where, again, like integrated care comes handy, because in that program, part of our requirement too is that like I'll reach out to the PCP, I'll confirm that it's okay for them to start a walking program. I'll talk a little bit about what it's actually like and what it involves, and they'll kind of give me the sign off for like, yes, this patient can start a walking program. So like that is one component of our therapy. And then other components of it are like working on cognitive interventions. Other components are like working on relaxation practices. So it's really, even within just the psychotherapy, we are trying to kind of like target all of these different areas of functioning, because that's just what we see works most, right? Like if we just focus on mood without actually focusing on the activity and the things that you're avoiding and the cognitions, we just don't see as much improvement. So that's kind of what the therapy looks like.
That's huge for someone who doesn't have or who has chronic pain, because you know you go to a doctor and your doctor's gonna tell you, all right, what's wrong with you, you know, your X is
Yeah.
fractured here, and then you're just like, okay, I'm just gonna sit in bed for as long as possible, and it gets worse and worse. And I feel like a therapist, or you know, someone who's there who can teach you or tell you and reaffirm that it's a pain, it's going to be there, but you have to be with that pain and kind of have to just not let it overtake you.
Or not let it like stop you from living your life in meaningful ways, right? Like I think that there's a challenge, because there is real loss. Like for a lot of people there is significant loss, and especially, you know, I've worked with people who are like very active throughout their lives. I've worked with people who are like just athletes for most of their younger years, and then like get into an injury while playing the sport that they love, and then are not able to play it anymore. And it's like there is significant grief and loss, and just like losing that part of your identity, right? Because we are constantly walking through the world kind of defining ourselves by the things that we do and the things that we care about, right? Like I define myself as like a graduate student, I did for so long, or like a tennis player, like whatever, right? You have all these roles that you identify with. And then I think with chronic pain, one of the things that happens is that all of a sudden you feel like, oh, all of those things are taken away from me. And maybe not all, but if a lot of those things are taken away from you, there is this moment where, you know, I think there's a little bit of like internal crises, because all of a sudden, if those roles are taken away from you, like what does that leave, right? Like there's these existential questions of like, what is my purpose in life and what is the meaning of life if I all of a sudden don't have access to the things that I love most? And I think, you know, part of the therapy and part of what we do in therapy is trying to remind folks very gently that like perhaps that thing that you loved in its same form, right? Like, so maybe if you were a football player your entire life, perhaps that is no longer accessible to you, right? And that is just something that your body cannot tolerate anymore, because it is a very physically demanding sport and puts you at higher risk of injury, right? So perhaps that is not accessible to you anymore. And at the same time, can we think creatively about what it is about that is so meaningful to you, right? Like, what is it about that activity? Is it being outside? Is it being in a game that's strategic? Is it, you know, being in a social environment? Is it collaborating, right? Like, what are the values underneath that? And can we get at an activity that taps into those same values, but in a different way? And so this is a lot of the work that I think is done in pain psychology, which is like a lot of values work, to be honest, because people are not all constantly having these existential questions about themselves, their lives, what it all means, what the purpose is. And so you're doing a lot of this like values exploration work with them. And then it's a lot of just kind of exposure. It's a lot of like acknowledging the role of avoidance in making things worse over time, right? Like we avoid the things that scare us. That's a natural human inclination we have. And then over time, our anxiety about that thing just builds. That's just how our anxiety works, is that the more we try to push it away, the more we try to avoid it, the worse it gets over time. So it's a lot of values work. It's a lot of kind of exposure, and a lot of like small goal setting to hopefully help people kind of explore what their life means to them now, and to kind of remind themselves of what the important pieces of it are and how they can still connect with some of those underlying values, even if it's in a different way, right? Even if it's in a different avenue. So again, maybe it's not through football, but maybe it's through another sport that is also outdoors, that also requires strategy and teamwork and collaboration. And so it's a lot of just kind of like working through those nitty-gritty situations with people.
Yes, and that sounds very tough, especially exposure for someone who is already in a state of a more fragile state, a more broken down state, to get them exposed because like I don't know, you're the provider, medical provider, but it seems like you know, most of the people in that person's lives are probably, you know, being a little easy on them, being a lot more gentler, you know, just trying to get them through the day. And you, as the mental health care provider, kind of have to be that rock. It seems like to me where you're just like, no, you got to get through this right now. We've got to do some work here.
Yeah, it is a little bit of that. I mean, we do it very, very gently, and we do it like depending on where the person's at. But yeah, I mean, another big part of what we do in the cognitive behavioral therapy for chronic pain is that we do a program that's all focused on pacing and pacing of activities, and specifically time-based pacing, because that's what we see can be really helpful for folks with chronic pain, which is essentially you kind of very strategically break up your activity based on how much time you can tolerate doing that activity before you anticipate that the pain is going to increase to a level that you can't tolerate. And so we do that beforehand, right? Before this person, for example, like oftentimes we'll start it with things like chores, like physical chores, like mowing the lawn or like vacuuming or sweeping, things that people kind of like drop because they say like my pain is really bad and I can't do that anymore. And then like you're mentioning, like people around them might say like, okay, we won't make you do that anymore. And so we start to kind of drop some of these activities. And so the ones that, that sometimes there are ones that are dropped that just need to be creatively re-engaged in, that it's like it's not that we can't do that ever, it's that you might have to do it in a different way that feels really weird for you. For example, like sometimes when we're doing time-based pacing, what we'll do is like part of the plan, like we use all these handouts and structures, and there's a lot of pre-planning in place, but it'll maybe look something like, well, you can't vacuum your entire house in one go, and I know that that feels really frustrating for you because it feels not pleasant to leave things unfinished, right? Like who likes to leave half of their house vacuumed and come back to it? No one, yeah. But maybe you try vacuuming for 10 minutes at a time and you take a 5-minute break and you create these really structured periods of activity and rest, activity and rest. And over time, you start to kind of increase the number of times you're cycling through that. So on the first day, you're maybe doing the activity for 10 minutes and then you're resting for 5 minutes. And then you do another 10 minutes and then you rest for 5 minutes. And maybe on the first day, that's all you do, right? You do 2 cycles of that. But over time, you can gradually kind of increase that. And that's how we see people actually build physical stamina. That's part of what they do in physical therapy with a physical therapist who specializes in chronic pain, is that they're kind of slowly pacing their activities and building up their stamina over time. So, there's absolutely like that balance of acknowledging the loss, acknowledging the validity of like living in a body that is kind of like yelling at you all the time, right? Like it's just like screaming at you, that alarm signal. And so acknowledging that like that is a really challenging place to be in at every hour of the day. And also acknowledging the other things in life that are important to you that you perhaps have put down for a while. And thinking about like what are the pieces of it that you really feel like are important for you to re-engage in, and how do we start to move towards that direction? So it's challenging for sure, but I think it's also like I think it can be incredibly validating just to hear that acknowledgement that like this is incredibly hard for any human being to withstand, and it's not an easy thing, and it takes a toll on us, and all of that grief and loss is valid. I think that in and of itself is something that a lot of people may not have ever heard, may not have ever felt validated from like their loved ones or their family. And so I think even that becomes like such a foundational piece of the healing that they get from therapy. And then from there, it's like, okay, and what are the things that you really care about that you want to be doing more of? And let's just see, like, let's see if it's within the realm possibilities for you to still do that safely, right? Because we can talk to your physical therapist, we can talk to an occupational therapist, we can talk to your primary care doc, we can talk to your pain physician, we can talk to whoever we need to on the medical side. if it makes you feel more safe and more comfortable knowing that like this might actually be within your realm of functioning, right? And you won't really know that until you try again. You just don't.
No, and some people without, that sort of like that reminder, that just that one person that tells them this is going to be really tough. This is not easy, but we're going to get through this, 10 minutes today, 5 minutes rest, 10 minutes. And then if you have to stop, you're done. But
Yeah,
without that person there, providing guidance, providing support, it's like that could be delayed for months or years. That just, I mean, that's a physical demanding thing that, just because of some sort of mental blockage within, however we're thinking, just, there's pain there. So now we're screaming out and don't want to do anything at all. That affects our physical lives, but it's really a mental barrier. And
absolutely.
I think it's very tough. And for some people, almost they won't acknowledge that that's a mental barrier. And so that's one of my questions actually, is how do you get your referrals? Does the PCP ever say to the individual, I think you would benefit here if you saw one of our mental health care providers? Is that usually how it goes?
That's usually how it goes. And I think in a system that functions well, that's typically how it goes, which is that it becomes just kind of another treatment intervention, right? It becomes another avenue that they can refer folks. And for a lot of the folks that I see for chronic pain specifically, it's just that they're experiencing a lot of emotional distress related to their chronic pain, right? So they might be experiencing sleep disturbance, they might be experiencing difficulty managing their anger, they might be experiencing difficulties with their relationships because of chronic pain. So they're noticing all of these other impacts on different areas of their lives. And naturally, like, those are all difficult things to be experiencing as a human being. So they're experiencing more distress in the context of all of that, and then come to see their primary care doc or come to see some other physician and express their emotional distress. And then that's typically when folks are referred over to us. So yeah, that is usually what the referral route looks like.
Nice. It's tough because some people, that word therapy really can have a negative connotation to it.
Um, yeah. Yeah, it's hard because I mean, I think even the words mental health are like so scary to so many people. And even to me, it's like, it's still, I'm in this world and it still feels so sterile and clinical to me, right? Like mental health. Okay, what does that actually mean? The health of your mental well-being. Yeah, it's such a stigmatizing word. I think therapy can be really scary for people to hear. Mental health is scary for people to hear. Psychology is definitely scary for people to hear. Psychiatry is scary to hear. I think there's like some people who will refer to it as behavioral health. So it's like your health as it relates to the behaviors that might be contributing to it, or thinking about how you shift your behavior. And I think that sometimes feels a little bit more accessible. In reality, it's all very tied together. But yeah, I think there's value to introducing services, and I think especially introducing our services in a way that makes it a little bit more accessible. And so yeah, I mean, especially in those like integrated models where mental health is integrating into a new medical clinic, a lot of the initial period of that development is just focused on actually kind of training providers, training the medical staff, training nurses on how to introduce mental health services and how to talk about that with patients and how to bring that up in a way that isn't so stigmatizing or isn't so scary that it immediately kind of sets off their alarm signal. So there's a lot of work that goes on the back end of just trying to make it a little bit more accessible within the system, which I think is like important, and it honestly takes a long time to like change the culture of a clinic, to go from a clinic that is not integrated and is just medical to then having mental health staff, whether it's psychiatry or psychology, because it does, I mean, it requires a pretty major shift in just kind of how the clinic functions and how the clinics kind of conceptualize patient health and what they need. I mean, it's a hard ask sometimes to start to change those things, but it's good. I mean, ultimately it like, leads to better patient outcomes. Patients are more satisfied. And I think patients are just happy to have access to the services that they need.
I think so too. I think if that's more accessible and if the other healthcare providers are able to bring that up without, any sort of with just like nonchalant, just bring that up. Oh, would you
Yeah,
like to see our mental health care provider or something? It's like, sure, you just brought that up. I didn't have to
totally,
think about it. But then if they,
totally.
what were you gonna say?
I was just gonna say, yeah, I mean, I think that's it, right? It's like, how do you introduce this in the most casual of ways? Like, this person is just a part of our team. They meet with every patient that we meet with, and like, they're here in our clinic. Are you open to meeting with them for 10 minutes today? And that's kind of what it looks like. We do these warm handoffs where, like, well, pre-COVID, this is what it would look like: is that the provider would mention that to our patients, see if they're willing to meet with us, and then we literally just go into the exam room. Provider would introduce us to the patient. We'd all sit there for about a minute, just kind of doing introductions. I'd introduce like what I do in the clinic, what they can expect, and just ask them if they'd be willing to talk for a few minutes. And that's really the process by which we try to increase access to mental health resources, is by just being physically available, being there to be able to like do those handoffs with providers, and being able to just like casually come into the exam room and chat with them, just like any other provider would, right? Because you think about it, and like, you go to your primary care doc, there's usually nursing staff that comes and pulls you back. They take your vitals, they take your weight, they take your height, they put you in the room, they might ask you your initial screening questions, and then a totally different provider, your actual your physician, then comes into the room. And so that's already a part of the system. So I think it's just about like how to just introduce some new players into that system in a way that is just as seamless, right? Where this is just a part of how we function. There's no stigma around it. This doesn't mean that you're crazy. This doesn't mean that you're unwell. This just is a part of our health. And it is, right? Like, it is just a part of our health. I mean, it is just something that we need access to resources around. And we can many highly functional people struggle with their mental health, and that is a normal part of their experience, and continue to be highly functional in this world and incredibly successful. So we you can think about that, and then just think about how much stigma there is, and how hard it can be for people to actually seek support, because it's just not culturally normative, and especially in certain communities. And so all of those things act as such major barriers to access. And so the goal of integrated care is to kind of remove some of those barriers. But of course, that's like, that is the ideal version of it, right? Is that all of those things are functioning really well, and the team is functioning really well, and there's a lot of cohesion, and everyone knows each other's roles. Like, that is the ideal system, right? So in practice, there's a lot of growing pains, and there's a lot of personalities, and there's a lot of differing opinions, and you have to kind of make room for all of that. But it's promising, like, it's nice to think that people can have a more holistic approach to their own care, and just get the services that they need in the same place. Like, that sounds lovely for all of us. That sounds lovely for me. I'm like, I want that out of my medical care.
Yes, me too. And it's way easier to handle if it's part of the system and if it's preventative. Like, I think you were speaking about it before, taking steps to mitigate whatever actions you might be taking to reach a point where you go past a precipice. you know
Yeah.
it's because getting past there, you know it's tough to come back versus just like you're still not there, but you're heading towards a pretty poor direction.
Yeah. And imagine if, like, somewhere along the way, that had just been screened for, right? Like, that had been caught, that someone had been able to tell that, like, you were perhaps headed in a direction where your mental health was going to take a downturn, and you had an intervention there. So, like, much earlier in the process, rather than, I've been experiencing depression for 7 years, and it took me this long to decide that I'm willing to talk to someone about it, because, it's not pleasant for anyone their first time. So that's oftentimes what happens, is that, like, the people that I see a lot of the time, like, you've been dealing with this on your own for so long. You've been struggling with this on your own, and there was always care there, right? You just have to know how to access it, which is, that is on us, as like, that is on, I think, healthcare providers and public health initiatives. Like, that is on us to figure out. That's not necessarily on patients. We just need to make it more accessible for people. And it's just not right now. Like, even in in like my personal life of like having like friends or family members reach out to me for referrals for like mental health providers in the community. Like it is so challenging to find a mental health provider in the community sometimes. Like sometimes you call like 6 or 7 people and literally don't get a response from any of those people in like 2 weeks because they're just not taking patients or they just don't get your messages. So things like that this happen, and I hear these stories all the time, and I know that they're true. Like that is just how convoluted it can sometimes feel to get the mental health care that you need, which is heartbreaking, right? To like to imagine that there could be a reality where it is just a part of your medical care. It is exactly where your PCP resides. You don't have to be like scrounging through Psychology Today or online databases or looking at that like 20-page list your insurance company sent you. You just go to your primary care doctor and there's a mental health provider there and you just talk to them. Like that sounds like a system I would want to be a part of. And I think that's where we're generally like moving in the direction of, but I'm sure that it's going to take a while to actually get to that point where most people have access to something like that.
Definitely on a national scale. Oh, very,
I
very
know.
long.
Yeah, it will. It probably will. But we're moving to that direction because honestly, most of like the academic medical centers and the like schools of medicine throughout the country like have that model. I think many of them do have that model of integrated care. I work for the VA system and we've actually been kind of at the forefront of that model for the last several decades of integrating mental health resources into the primary care clinic. So large healthcare systems, I think, have the luxury of being able to do that a little bit more easily. The challenge will be just kind of generalizing that, and then the challenge will also be like in rural areas. Like I live in Los Angeles, and so we have a lot of providers in every direction, but for people who live in rural areas in the country, like it is not easy to find a provider. And granted, we now have like telehealth, right, which is so much more expanded because of the pandemic. But before that, there weren't that many telehealth providers who were able to see folks in rural areas. So there's constantly kind of a shortage of providers in rural areas. So these are all, I think, some of the pieces that just make it messy that we will, as a healthcare system, as healthcare systems, will need to sort out.
Yes, we'll definitely need to sort that out. I think I've read or heard some information that rural areas and rural hospitals are it's that's where a lot of pricing issues also with people who are uninsured come into play,
Mm,
because there aren't multiple healthcare providers there either, so they're not able to have a choice of an individual, say without healthcare insurance, doesn't have as much choice as they would in a city. So that lack of supply of, first, what obvious was physical health and mental health is there in those sort of environments. That, I live in San Diego, you live in Los Angeles, two great cities for healthcare. And so, you go 1 mile anyway and you're at a
right,
hospital.
right. Yeah, that is a luxury, right? That is a luxury of living in in a in a setting that we live in,
It is a
but
luxury.
not what most people have access to in the rest of the country.
No. UC San Diego, actually, when I was there for undergrad, I remember, I don't know how I got there, but there was a point where I was feeling a bit down at one point, and getting a therapist was really easy. I don't know
Yeah,
how, but I mean, I feel in college, undergrad, it was also very well communicated to us as well. Like, take
yeah,
care of your mental health. This is a real thing. You might feel down some days, and then we have resources here for you to help. So, and that was great. I went there, talked to them, just got, it's good to share, because, I was 19 at the time and I had no interest in telling any of my friends this.
right, right. Who does? Yeah, at
No
the age
one
of
who does.
19, who wants to talk about that? Yeah,
No, no one wants to talk about that. And we have to. And it should be, like, it should be something that happens beforehand, so that if it ever does get to a point where it does, we don't want to get to the overwhelming point, which I
right.
feel like a lot of people have over the last, 50, however many years we've noticed that mental health has, become more of a problem in society.
Yeah. Yeah, you're right. I mean, I'm thinking about this now, and really college counseling is like the universities really get it. And I think part of it is that, like it's such a big transition for so many people. Of course, like when you're starting college and you're like away from your family and from your friends for the first time, you're like taking this very demanding academic load. So like there's so many factors that would play into your mental health being impacted. But you're right, like that is the beauty of, I mean, at least, we both went to a UC. So I went to UCI, you went to UCSD. I'm assuming our services were really similar. It was the easiest, right? Like I literally just went to the main like health center, and you just like get whatever materials you need. You can talk about whether you want to get connected with mental health. They have like all these classes and groups. Like they really make it accessible, which like, it that wouldn't that be nice if that just was the case for all systems, right? And all
Yes.
institutions. And I think there is it is nice that like work also has to offer EAP programs, right? Employee assistance programs where you can get some counseling through work. Like it's nice that there are some systems where you can have access to that, but somehow like even within the medical system where you would think like it should be the easiest to be able to get connected with mental health. Like you should be able to just go to the go to the same hospital building that you go to for everything else and see your provider there. And yet like for so many people that's not what it looks like, or it's so challenging, or the wait times are so long, or the provider that you end up with is someone that doesn't fit for you, and then you feel bad about asking for a new provider. There's so many barriers. Whereas like, a person can decide like, oh, I don't want this primary care doc, I want a different primary care doc, and just like fire their primary care doc and have a different physician all of a sudden. And that's a thing that can happen very easily in a medical system. But somehow it's I think we just don't have the systems in place as much for just having access to that kind of mental health, those kind of resources. But I'm hopeful that we will, and we're working in that direction for sure. Just a slow moving process.
It's very slow. I can empathize with it for sure. Have you been in a clinic that has undergone that transition of being, doesn't really have a model of health or mental health care
Mm.
supply in it, and then they're transitioning into a model that integrates it?
That is a great question. I have not. I've worked with a lot of people who have. And so the things that I know about like how to start that are purely just from hearing it from other colleagues. I have been honestly really lucky to only work in clinics where that's already been fully integrated. So like in all of the clinics that I've worked in so far, like I've always kind of had an established set of responsibilities. I knew what was expected of me as a mental health provider there. There were already systems in place for referrals and warm handoffs and all of the things. But there are plenty of people who, are in this field and are especially who specialize in like primary care mental health integration, which is literally just, primary care and mental health being integrated within it. It's its own little subspecialty. There are plenty of people who really just focus on like the program development side of it, which is like going into clinics where they don't have any of those systems in place and starting that from the very beginning. And it is like a massive undertaking in a lot of ways. I mean, I know like next to nothing about like actual healthcare policy or like insurance policy. Like those are things that I have a lot to learn about. So I'm sure that that piece of it in and of itself is huge. But yeah, it's a major systems change. It's a major culture change. And there's just so many little things that need to be established from an early point, to make sure that patients are actually getting good care. So yeah, I have not yet been in that role.
Nice, congratulations.
I know, I know. I feel very lucky. Like I've always just kind of shown up and I'm like, oh, it's great. They already like they're appreciative that I'm here. I'm not like fighting for space. I'm not fighting for time. It's like I've been welcomed into most of the spaces that I've worked at. And I'm sure that's also just a function of like, having been a trainee in those environments and in those spaces. So yeah, it's been a treat for sure.
Awesome. How many clinics did you train at during your graduate school program?
Let's see, how many clinics did I train? Oh my God. Um, I had probably 4 to 6 different clinical training sites throughout my 3 years when I was in Oregon. And then I did so for my internship, I was at the University of Colorado School of Medicine. And so it was technically one site, but even there I was like, my major rotation was in primary care. So that was the rotation that I was in all year. But then I had 2 6-month rotations, like one in a substance use disorders clinic through the CU School of Medicine, and then one in the bone marrow transplant unit, also through the CU School of Medicine. So like there were different sites technically, like as far as what I was doing. So there was that. And then last year on postdoc, I was part of 6 different specialty clinics throughout my week. So like literally I just like have half day clinics, and like it was hilarious. I loved it, and I like, my brain thrives in that environment. So it was fun because I was always doing something new. But so across all of grad school, somewhere like 20 different, 26 plus 4, no, like 14 to 20 different sites or or clinics. I'll believe it as a big range.
Did any stand out in particular
For like being really well integrated.
for being well integrated, or anything in general that you appreciated or thought was maybe effective or just a good clinical system?
Yeah, my favorite to date has been through my internship. So I was working at this primary care clinic at the CU School of Medicine. My position was actually funded through the family medicine department, it was a family medicine residency training clinic. So meaning that the clinic that I was working at is where all the residents who were specializing in family medicine through the School of Medicine were actually doing their training. So all the resident physicians that I was working with were people who knew that they wanted to be working in family medicine for their lives. And family medicine is just like, it is a demanding work life, but like I feel like certain people are drawn to that. And it's usually like, I mean, in my experience, they were all just like very lovely, warm, kind-hearted, psychologically minded people for the most part. Like I think part of it is that you're working in a clinic where you're working with entire families, right? You're working with people across the lifespan. So like from ages, literally 6 months old to people at like end of life. And all of those people are receiving their care in the same clinic. So there was just a wide age range. You're working with families. And so in that clinic, I just felt like, was probably the most well integrated. It was also just the psychology staff there were amazing. My supervisors were incredible. They had done so much work to get to that point, but it still really stands out as like the beacon of like what integrated care can look like and feel like to me, where like truly, even as a psychology trainee, I felt like so at home with the staff and just felt so like connected to the other healthcare providers. We had so many different avenues for communication about patient care. Most of my day, when I wasn't seeing my own scheduled patients, I was just sitting in the attending room, which is kind of the room where all the medical attendings will sit in. So I'll give you some context. So when you work in a residency training clinic where residents are actually training to, they're not independent practitioners yet, what they do is that they staff all their cases, right? So they'll see their patients and then they come back to the attending room and they staff all their cases with their attending physician. They're basically their supervisor. And so we would just be sitting in that room, like listening to people staff their cases and say like, oh, that person sounds like someone who would really benefit from talking to us for a few minutes. Would you be okay with me just like hopping in to say hi and like setting something up? And I literally, while they're still staffing their case, just like hop in, say hello, see if they might need anything, if they might need any resources for mental health, and then pop out. And it's like 5-minute little encounters like that where, we're not taking away any time from the actual visit. We're not taking away any of the time from the provider and the patient. That patient is just kind of sitting there waiting anyway. So as long as they're okay with meeting with us, we just pop in and say hi. And so I think that was a system where, that's just one example, but so many pieces of it, I was like, wow, this is what truly integrated care feels like. And it was just awesome. It was like such a rewarding environment to be in. I really, really love that clinic.
That sounds very rewarding. Is this 1 year internship you said that this is for PsyD majors, they all on their 5th year take this internship program?
Everyone does a different one, but yeah, so everyone does, it's called your pre-doctoral internship. And so in your 4th or 5th year, so depending if you're in a PhD program or in a PsyD program, somewhere in your like 4th, 5th, or 6th year, actually, for some PhD programs, you start applying for the internships, and all the PhD programs and PsyD programs are applying for the same internship sites. And so it's a super intense and competitive process.
Is this
But
psychology only?
yes. So
Okay.
just for psychology doctoral programs. Yep. So it can actually either be like, even if you have like a doctorate in education, but are doing like a counseling psychology or a psychology program, if it's psychology oriented, like you are all in the same match system. So that's where you apply to like really as many as you can and like as you're willing to pay for. It's really expensive. And then you interview and then you match. So yeah, I did mine in Colorado, but like you oftentimes, people move all over the country to do their internship for that year. And then people also often move all over the country to do their fellowship the year after.
Great. And that's what you meant earlier when you said, you felt like your path was a lot more regimented when you first began your programming, but by this internship, you were there with PhDs, and it was all you were all at the same end route, no matter how you got there through the first 4 years.
Yeah, I think I saw it actually more. I feel like if I'm, oh yeah, yeah, I think maybe an internship, and then definitely last year, like several of the people that I was working with in my postdoc cohort, my fellowship cohort, were PhD. So it's, I think you just realize after the fact, you're like, oh, I was just being unnecessarily rigid around what I thought it was gonna look like if I was in a PhD program, and just didn't even really like, I didn't even end up doing that much research on it, right? Like I probably could have looked at programs who did a lot more clinical work. I think that's what you learn is that it's, there are PsyD programs that are really research oriented, but are still PsyD programs. And that's one of the ones the one that I landed out. That's part of why I went there. Cause I was like, oh, they're still doing a lot of research and that's really exciting. And then there are PhD programs who are, of course, doing a lot of research, but are very clinically oriented as well. So like you can find a lot of different programs across the spectrum. So I think after the fact, I was like, oh, right, that's something that like, when you're an undergrad and you don't have someone who's already gone through that path, you just like you don't really know exactly what that looks like, right? And so I was doing a lot of like, I did a lot of informational interviews with like people just generally in mental health. Like I talked to a couple social workers. I talked to like my older cousin who was like in industrial organizational psychology. I talked to a couple folks, but I didn't have that many people who were doing clinical psychology. And so these are all the things that you learn along the way, and it was fun, and I stand by it so far. But yeah, just the pieces that I later learned, I was like, it probably I didn't need to be that rigid around it. It probably kind of could have ended up in similar ways regardless.
Nice. And you enjoyed your route, didn't you,
I did.
at
I loved
Oregon?
it. Yeah, I was in Oregon for 4 years and then in Colorado for a year and then did my fellowship last year in LA. Came back home and that's been great. So I'm very happy. I mean, I feel very fortunate. I just had a lot of opportunities that um, I feel like was really partially just due to having amazing mentors and people along the way who like encouraged me to go after things that like maybe even in that moment I didn't necessarily feel I was like capable of doing or capable of achieving. And sometimes you just need those people to push you along the way and to encourage you. And I feel like I had so much of that support throughout grad school. So ultimately, like I'm so happy with the route that I took. But there's so many different routes and you can still end up as a clinical psychologist. But yeah, I'm done with that piece of it, which feels really nice.
And now you're at you are the clinical psychologist now.
I am. I sure am. Yep. As of a month ago, I was licensed.
Oh, wow,
So that was the last
congratulations.
piece. Yeah, thank you. Thank you. It was a year-long licensure process. But that is finally done. So yeah, I'm a clinical psychologist. I'm like no longer a trainee. It's a big transition, but it's been great.
Great. Were you still, even as a trainee, doing, pretty much were you as clinical psychologist, just trainee by title?
So we at different parts of at different points in training you have like different titles. So like last even in the first half of this year when I was like hired on as staff but I was not yet licensed, I would call myself a graduate psychologist or a staff psychologist, but you can't call yourself a clinical psychologist until you have your clinical psychology license. So like that was a piece of it. But like as far as like job functions, you're basically doing all the same things except that you have a lot of supervision and a lot of training and a lot of resources. So like all of your notes are signed by your supervisor whose license you're working under, who like, grateful for all the amazing supervisors I have. And then you're doing a lot of like case consultation with them. And then if any like high risk situations come up, you're like really talking through it with your supervisor because all of it is on their license, right? So there's a huge focus on just like consulting and getting a lot of supervision.
Nice. So now you don't have to get any signatures.
I'm done. Yeah, no,
Hell
no
yeah.
more signatures. No more signatures. No one signing my notes. I'm like I'm like happy for my supervisor who, bless her heart, like continued to sign my notes, even when I was staff because I was just waiting for my license. But yeah, so all of that is done with now, which is very freeing. It's very liberating. I can confirm.
That's awesome to hear. I mean, you seem to have worked very hard over the last 10 years to get here.
For sure. It was a long road. Yeah, I mean, I think like anyone who is in like medicine and really any doctoral program is just like it's a long road. There's so many hurt little things, little and not so little things along the way. And it's all just like a practice of delayed gratification. You're just like constantly like putting in work, putting in work, putting in work, not seeing the immediate impacts of it at all. Just like reminding yourself, okay, I'm doing this because in 7 to 9 years, that this is the life that I want for myself. So it's a huge practice of delayed gratification, but ultimately incredible. And it's like still fun along the way. It's not like for, all of that time, I was just like not enjoying my life. It was just a lot of work. It was a lot of work.
Yes. And I don't see that work, drop that work amount dropping off in the future either.
I don't think it stops. One of my mentors in grad school early on told me it's your workload stays the same. In fact, you'll probably have more things on your plate as you move forward, but your tolerance for it will increase, and that will be all that matters. And I'm like, I feel that so much. Like I'm doing just as much, if not more. Granted, maybe like some years in grad school, it really is like it was tough some years of like just how much like just like 13-hour days regularly of like clinic and school and class. And now I work from 8 to 4:30, and that feels like such a luxury. I'm like, I get off at 4:30 and I'm done with work and I have nothing else to do. So in some small ways the work has actually just decreased, but I do think you just kind of get used to it. And your tolerance for it goes up pretty dramatically through grad school. I feel like that's also part of the learning curve, is like you just kind of learn how to manage stress and manage having a lot of things on your plate at once.
That's good training for people in your profession,
For sure.
for
For
sure.
sure. For sure. Good point. Ugh.
One thing that, that sorry to bounce around a little bit, but before we wrap up, you mentioned when we're talking about pain management psych I'm sorry, pain management therapy, that you handle or you go through value work, what would you call it, value exercises with your patients.
Mhm.
What, so, and you said that, for example, if they were a football player, you try to find the underlying values of what made them love football. Are there any sort of piece of advice or sort of lessons that you feel are important when it comes to values and how we can relate them with our activities and mental health?
Yeah, I think Hmm, I'll try to be concise. I think that my biggest piece of advice would be to actually kind of take stock and to take a look at your own values and to ask yourself exactly what they are. I think it starts with just kind of building awareness around why you're doing the things that you're doing, right? Like we constantly are making decisions for ourselves and our lives and our professional lives and our families, and we're making those decisions. And I think the biggest piece of advice I have is like ask yourself what is driving those decisions, right? Like, what are you hoping is on the other side of that? And why is that important to you? If it's like, you know, becoming really successful at X or Y job, why is that? Like, what is success going to bring you that is really important to you in life? Is it going to bring you peace of mind with your finances? Is it going to bring you then more time with your family because you're hoping you'll work less over your lifespan? Like, is it going to bring you more important memories with your loved ones because you'll be able to like take the vacations that you'd like or do X, Y, or Z? So I think just kind of asking yourself like the why that is underlying your actions and your behaviors and your goals and the things that you're saying are really important to you, and just kind of spending some time actually thinking through what your values are. I think it's like it feels like such an abstract concept sometimes, and at the same time it's I think good to just take a moment to pause and take stock, because if you don't, then what ends up happening is that we just do a lot of things because they're expected of us, or we feel like we should, or by society standards we feel like we should. There's a lot of should statements in that. Or we just kind of act on autopilot, right? Like we kind of start to live life a little bit mindlessly and just kind of go through the motions because what else, right? Like that's just what we do. That's what we're built for. Like that's kind of like what our society dictates from us. It's like find something that you're going to be productive at and then just like do that for the rest of your life, and that's
Make
it, right? Like
money.
that's yeah, and that's it. So I think part of the value of values, or the value of doing values exploration, is trying to understand why you're doing all that. Like, what is your ultimate goal? What are the things that are actually driving you? Like, what are the motivating forces that are keeping you going in the face of adversity, in the face of hardship? And even better yet, like, if all of those things were to be taken away from you, if your roles were to be taken away from you and your job was to be taken away from you, like you would be left with who you are at your core and yourself and your values, right? Like those are the things that continue there, and you get to decide how you want to keep living, whether or not you have all these roles that you are no longer able to identify with. And so I think it's like, it's meaningful work that is kind of at the basis of who we are and what our life is about and what we care about. And so just taking time to reflect on that and to talk about that and to, reflect on that individually, but like talking about it with your partner and talking about it with your family and kind of getting a better sense of like where these values, how they came to be yours, right? Because usually they're passed down to us in a lot of ways. And so I feel like all of that work is just a nice way to get to know yourself better and to get to know the people that you love better. And that feels important, right? Ultimately, like that's, values are our why and our motivating force in life. And why not know those reasons, right? Why not feel connected to that?
I I think so too. And reaffirming those and even defining them to begin with are huge, because we can go through our whole lives and just, not just do it. We'll just work and find what we're good at and just do that. And when that's taken away from us, we question our purpose and what's it can really be daunting for some people. I mean, for the athlete who loses their physical capability, or for the just average Joe who loses his job that he really needed. I mean, what do you have from there? Just ourselves. And if
Yeah.
we our values are really that. And you, so 2 weeks ago you put on an event called the Palette.
The palette is actually the name of the organizer, the organization that put on the event. But yeah, the palette is the organization itself. And then we did a values exploration workshop.
I attended that values exploration workshop.
Sweet.
I enjoyed it.
Nice.
I that that at one point you gave us a flashcard set of, I would say, over 100 different values.
Mhm.
And I just remember, most of them were values that I found important. I think, out of the over 100, maybe there were 15 that I put as not important. And one of them was service. And then that was our first exercise, to just separate important and non important. And then our second exercise was to actually pick our top 5 important values. And that was really tough, just because, there were, even getting it down to, I remember getting it down from 7 to 5 was just like, I value everything on here so much.
Yeah.
it's
Yeah.
it's very and even one of them, service, which I put as not important, after like thinking about it and thinking about it and thinking about it, I was like, wait, this is my top 5.
Oh,
So
wow. Yeah. You're like having an identity crisis in the middle of the values exploration. It's great.
exactly. It is an identity crisis, and just like more of a clarification of like a reaffirmation of, this is really, if if I look back on a successful day, something, if I provided service to someone that I value and someone that I respect, and someone that's kind and helped me, that is a good day. That is a valuable day.
Yeah.
And sometimes, just, I'm sure for people who need any sort of mental health just boost, that sort of teaching with can really provide some grounding sort of effects.
Absolutely. Yeah, I think that exercise is a really nice place to start for most people because it's like tangible, right? There's like something you can do. It makes these really abstract ideas a little bit more accessible. And so then in that moment, really all it comes down to is, am I going to put this in my important pile or not important pile? And that's a much easier question to ask yourself in that moment and kind of like go with your gut than it is to just like reflect on your values in general and try to think if you're connected to them, right? That is a like heady conversation to have with yourself. And so I do really love that exercise. It's like kind of the initial way where people just can start to explore their values and get a sense of like, oh, what are the things that my gut is telling me are really important to me versus what are the things that I thought were really important to me my entire life because I had just said that they were because, somewhere along the way I learned that they're supposed to be important to me. And then you do this exercise and you're like, oh, this is not one that's really standing out to me. I think I maybe shared this example of the one that came up for me recently was loyalty. And it came up because a friend of mine had kind of mentioned that. He reached out to me and was like, is this something that you value in life? Like loyalty. I'm thinking about this concept of loyalty. And I realized I was like, you know what? If you'd asked me maybe 10 years ago, I'd be like, loyalty is one of the most important things. Show up for your people. And then in that conversation, I was like, you know what? That in and of itself is not necessarily one of my top values. Like I know that as a society, we've decided that loyalty is supposed to be the most important thing. But to me, I was like, actually, like honesty, truthfulness, kindness, those are all far more important to me than loyalty, like than this like blind, rigid support just because you feel like you should, because you have a pre-established relationship with someone. I'm like, no, I'd rather have you be honest with me and be transparent with me and be kind to me when I need it or be compassionate. Those things are all ultimately more important to me than loyalty. But, again, this is like, we're all so different and we all get our values from different places and they're shaped by different experiences that we've had. So I'm sure that if someone who had had a lot of life experiences where they felt like their value of loyalty was like ruptured or not seen or not respected, right? Like if someone experienced a lot of infidelity or a lot of like breaks in the trust in their relationships, then they probably would even stick even more strongly to that value, right? Because for them, it's been kind of like this defining value where they've experienced a lot of hurt and a lot of struggle that is related to that core value that they have. I think those are some of the ways that we kind of like become shaped by our values and how they become stronger over time. But for me, I was like, that's not really that important to me, right? And it is one that like when I say that out loud, I'm like, it also feels weird to say, oh, loyalty is not important to me. There's this like secondary process of us judging ourselves for saying that certain values are more important than other values, even though it's like purely an individual process, right? Like I know rationally no one's going to judge me for sharing my values, even in a public space for the most part. But we have
For the
judgments
most
around
part.
it for the most part, but we have judgments around it. And so yeah, it's a nice introductory practice. I'm glad you were with us and I'm glad you enjoyed it. It can be a really eye-opening experience for someone who's never really reflected on their values, which is a lot of people. To be honest, a lot of people have never reflected on their values, and that's perfectly okay because what avenue did they have, right? Like where would they have done this other than in therapy and life coaching, or if they were like, adjacent to this field in some way.
Life, yes, exactly. You'd have to be in the field, or you'd have to go and really search for it. Or if you're lucky enough in the healthcare system, the clinic you're at, their healthcare system has an integrated model with mental health in it, then it shows up in your
You're
on your
right.
doorstep.
Yep. Then it shows up at your doctor's office when you least expect it. Yep, you're right.
Exactly. Well, Elika, thank you so much for coming on the podcast. Are there any last words that you'd like to say?
I don't think so. I mean, maybe other than if you are needing mental health resources, give yourself the gift of giving them to yourself and finding them for yourself and removing that barrier, that obstacle in your life. And I hope that more people can do that. But otherwise, thank you for having me. It was nice to chat and to catch up.
Thank you for coming on. It was nice to chat and catch up.
All right, take care.
Take care.
Bye.
Bye.